Welcome back to the WHHI Daily News. May is Brain Cancer Awareness Month, and we're talking today about the most common type of brain tumor in children and new treatments for it. We have a pediatrician, a specialist, a hematology oncology specialist with the University of Florida with us, Matthew Cascio, Dr. Cascio, and then we have Liz Dominguez with us. She is the mother of Gus, who is an 8-year-old little boy that does have a brain tumor. And it's actually called pediatric low-grade glioma. Is that correct, Dr. Cascio? Tell us what this is. It's actually the PLGG, sir.
Yes, PLGG is a pediatric low-grade glioma. As you mentioned, this is the most common brain tumor in children. About 1,700 children are diagnosed with a low-grade glioma every single year. It can present in different ways in children, largely dependent on the location and size of the tumor. Symptoms could include nausea, vomiting, headache, but also could include seizures, changes in vision, changes in balance. Could be very mild symptoms, but also could be very life-threatening as well.
So you, Dr. Cascio, you're the physician of Gus, and we have Gus's mom with us. So why don't we just flip over to Liz and tell us a little bit about Gus and his symptoms and how he's doing. He's 8 years old and does have this brain tumor. Is that still living with that, correct, Liz?
That's correct. Gus was diagnosed when he was 2 years old after having some problems walking, keeping his balance. And we've been battling this brain tumor for 6 years and counting now.
And so, Dr. Cascio, so there's new treatments, and do you want to talk about that and then how you're treating Gus?
Mm-hmm. Treatments could include surgery, radiation, and traditional chemotherapies, which is what we've done over the past many years. But more recently, we've developed what we call targeted therapies, and these approach tumors according to the identifiable genetic changes that occur in the cells of these tumors. For instance, changes in the gene known as BRAF or BRAF can cause low-grade gliomas through their development and progression of their growth. Up to about 3 out of 4 children with these low-grade gliomas will have some sort of BRAF genetic change in them that's driving their growth.
So Liz, how is Gus doing these days with these advanced treatments?
So we've had our share of struggles, and I think today is a good day, but every day can be different, and we definitely still have our highs and lows. We deal with the side effects and long-term effects of some of his previous treatments every day, and the fact that his brain tumor is still there inside of his head. So we may not see it, but we see its effects every day.
So any thoughts, Liz, or advice for families living with this particular type of brain tumor?
I've been recommending that folks take the same path that we did, is find therapy for yourself, for your family members, for your child. The emotional toll is great, and every year it gets even greater, and getting therapy is something that would be extremely helpful. I would also encourage any parents that are offered the choice of getting genetic testing on the tumor to make sure that you do that. We were given a choice, and we were so glad now that we accepted that option 6 years ago. It's pretty standard practice now, but if you're offered a choice, getting the genetic testing could be critical further down the line if you end up like us and having to continue to find treatments to manage the tumor.
Thank you, Liz. And Dr. Cascio, any final information that you can share with us about this disease?
Mm-hmm. Yes, most treatment options available for treating low-grade glioma are only FDA approved in adults. One particular type of targeted therapy known as Ojemda is the first and only FDA approved targeted therapy to treat children 6 months and older who have a low-grade glioma that has returned or did not respond to previous treatments, and they can, and it's very, very well tolerated. Folks can get more information about this drug, but also about low-grade gliomas on dayoneBio.com or Ojemda.com, and they can also get a full list of the side effects of Ojemda there.
Very good. Thank you so much, Dr. Cascio and Liz. Appreciate your time today. And that's a wrap for this edition of the WHHI Daily News. I'm Robyn Zimmerman. Thank you all so much for watching. Stay safe and healthy, and we'll see you next time. Bye-bye.